Just shy of a century ago, the very first patients entered the hallways of FirstHealth of the Carolinas. I think you'll agree it was to become a health system like no other. 4 hospitals, 15 counties, and thousands of patients later, it now includes Hope County. This brand new hospital is one more fulfillment of our ongoing promise to care for people. People who are worthy of a community healthcare institution that can treat their cancer, heart, primary care issues and offer a wide spectrum of specialists and make them well right here at home. What's amazing is that this healthcare system was built from the benevolence of the community it serves and out of excellence that attracts the very best in medicine. FirstHealth of the Carolinas has an extraordinary story to tell you. Better yet, let us show you.
The history of FirstHealth, or Moore Regional Hospital, goes back many years before I came here. And it's an interesting history in that FirstHealth, or Moore Regional, back in the early days, was very similar to all the other community hospitals around it. And it's interesting to see how FirstHealth has grown and become more than just a typical community hospital. And that was based on the idea that the previous physicians had a vision of creating a specialty-oriented community hospital, which was unheard of back in those days. And therefore, instead of having a bunch of generalists who did everything, they hired specialists early on and grew a very robust specialty practice, not only surgical but medical specialties. And as a result, we've grown in a way that is very similar to some of the bigger city hospitals and academic institutions, where we provide for 95% of the patients that come through our doors.
Oncology is one of the most rapidly changing specialties. You only have to watch the evening news or the morning talk shows to know that. We all spend a lot of time talking to each other about new developments, collaborating with physicians and academic medical centers as they sometimes have been more involved in some of these newer treatments than we do, and in going to medical meetings where we interact and hear presentations about these new treatments and how they should best be used.
We have a full range of cancer treatments here at Moore Regional Hospital, both in the radiation oncology department and in the medical oncology division and other areas as well. Here in radiation oncology, we have external beam radiation treatments using the most modern techniques, including intensity modulated radiation therapy and image guided radiation therapy. And we've just added the capability to do stereotactic radiosurgery and stereotactic body radiation therapy as well.
The biggest advantage to being treated close to home is the convenience it offers for patients and for their support services. Cancer has become a long-term illness for many people, and many times it's going to be something you're dealing with off and on for years.
The Reed Heart Center means so many things to so many people, and the Reed Heart Center on the surface is just an incredibly beautiful architectural design building. It creates a sense of oneness and health. It provides for cardiac services all under one roof in a comprehensive fashion. With that, we've been able to provide state-of-the-art technology and infrastructure. So we're able to provide the latest and greatest surgical and interventional techniques, as well as prevention and rehab and diagnostics. But it's more than just that. It's more than just bricks and mortar. It's really a concept of comprehensive cardiac care and a better way to take care of patients. It allows us to take care of the complete spectrum of cardiac disease under one roof, and also to practice patient-centered care, which to me is the most important, to give the patient the opportunity to participate in their health care.
At FirstHealth, we offer 6 of the 8 orthopedic specialties, including joint replacement, hand specialty, foot and ankle specialty, as well as spine and sports medicine. This is really not a typical community hospital. We have fellowship-trained orthopedic surgeons in 6 of the 8 subspecialties, and so many of the specific needs to each of our orthopedic surgeons and their subspecialties becomes very important and somewhat complicated. So regular meetings with the nurses, the operating room staff, as well as administration to facilitate these needs has been very paramount in improving our patient care.
When you're coming here, you have 2 surgeons who are involved in the patient's care that are experienced bariatric surgeons. Our program is set up for them to have lifelong success with the various components that we've talked about, being nutrition, psychological support, exercise support, in addition to the staff in the office here. The success of the program speaks for itself, and that our outcomes are good and are comparable to any program around.
What sets us apart is that we understand the importance of the team working together, collaborating and growing stronger along the way. From our board members to our frontline employees, everyone is highly engaged and strives to ensure that we are at the top decile in all of our quality metrics.
Well, our focus here at the FirstHealth Back and Neck Pain Clinic has always been on the evidence-based, minimally invasive treatment of spine problems. And the things that we do to try to make patients better might include things like physical therapy, stretching exercises, a variety of oral medications that can be tried. And we also collaborate closely with our surgical colleagues and other specialists that treat spine problems and make appropriate referrals to those specialists when necessary.
One of the things I'm most proud of with the Reed Heart Center is we built it with the understanding of it suits our needs currently, but it also allows us to look into the future. And we built some incredible infrastructure to support new technology and new procedures. Our hybrid operating rooms are one such example, where they are a combination cardiac catheterization laboratory and operating room to allow surgeons and cardiologists to work together on complex diseases. There's so many things going on in FirstHealth. We've concentrated mostly on cardiac services, but we are cutting edge in in all the specialties. Neurosurgery is an excellent example, where we are one of the few institutions to have a stealth navigation system to help isolate tumors of the brain and spine, and also help orient our neurosurgeons with some of the more complex spine surgery that we do.
The arms of FirstHealth of the Carolinas are 15 counties wide, embracing the region with 4 hospitals, nearly 600 beds, 5 fitness centers, dental clinics, home care programs, behavioral services, a beautiful hospice campus, family care centers, EMS services, and an insurance plan. In addition to more regional, is Richmond Memorial, a 99-bed community hospital serving the emergency and acute care needs of the people of Richmond County and the surrounding area. Also, Montgomery Memorial, primarily an outpatient acute care and emergency hospital caring for our Montgomery County patients. And more regional Hoke Campus, a 21st century medical complex anchored by a hospital with around-the-clock emergency services. Each hospital, often collaborating with the other, delivers a vital network of world-class medical care to our communities.
Several of the programs that we're very proud of include our dental program, where we serve the needs of our underserved children.
The FirstHealth Dental Care Centers were established to provide comprehensive dental care to underserved children up to age 18. And a lot of people ask, how did FirstHealth get involved with dental care? About 16 years ago, the school health nurses determined that the #1 unmet need in our service area among low-income children was dental. And since our purpose is to care for people, we were fortunate enough to be able to open 3 dental care centers to fulfill that need in our community.
Community Health Services Department is really an extension of the mission of FirstHealth, which is to care for people. And our focus is on underserved populations in our region, specifically Moore, Hoke, Montgomery, and Richmond counties. You're also talking charity care at the hospital. You're talking about everyone coming in the doors at the emergency room is going to get care, regardless of their ability to pay. And you're talking about bringing resources like physicians into communities that may otherwise not have access to physicians because maybe they're a small rural town.
We have a very, very strong and generous and committed community. that through 80 years, a long time, have supported our local hospital and our local health system.
We've talked about the Reed Heart Center, and we've talked about all the capital investments that we've been able to make because of the foundation. There are a lot of other things the foundation does too. The foundation educates the community through physicians and speakers, develop relationships with our philanthropic donors, and get them invested in our healthcare and in healthcare community. I think those relationships are strong because philanthropy is emotional, and it's more about the heart than it is about the brain. And we've been able to make people passionate about their healthcare in this community, and that's why we've been very successful.
I think that FirstHealth is different, number one, based on our location and based on our wonderful facilities. I think it is also unique due to the high quality nursing staff we have, as well as mentioned before, I think some of the best trained physicians that you'll find anywhere. But I think it goes beyond that. I think that there is truly a collaboration that exists between all the medical staff, whether they're in a private practice or part of the system, to truly provide the best care possible to our patients.
Why do we go to this extra effort? Why do we do what we do and bring in these extra dollars to provide unique programs to southeastern rural North Carolina? It's because it's part of the FirstHealth mission to care for people. I think one of the main things, that I can't think of any specific words, but just we try to help make it easier on them. And we try to help, I think bottom line, they realize that we are there to help them. And we come with no preconceived notions. We come with no outcome goals other than to try and provide help to these individuals and trying to make sure that they're healthier.
Hardly a day passes we don't hear about the evolution of healthcare in America. The landscape, no question, is changing at lightning speed. New ideas are on the horizon, not the least of which are the prolific advances in treatment and technology. FirstHealth's unending goal is to be out there right on the edge of it all. Yet at the same time, so is our respect for the things of medicine that should remain unchanged. The special relationship between physician and patient, the obligation to give back to the communities we serve, and most of all, the reassurance of knowing that all the world-class skill and medical science you may ever need is right here at home.